Hello friend, this is Dr. Syed Ibrahim. I'm currently working in USA for quite a long time and I've been making videos in my native language, that is Urdu, but I decided now to make videos in English language as well, as most of my American friends and friends like you outside USA can very well and better understand. Just to let you know that my videos are brief, without any details and medical terminologies. So these are simple points that I put together to make you understand in a simple language. Let's get started. The first topic that I have for you is why vitamin D is so important for our body. Vitamin D is also called sunshine vitamin. Would you believe that 40% American are deficient in vitamin D? 1 in 3 people in the world are having vitamin D deficiency. Yes. Why they are having? Because they are unaware about vitamin D deficiency because the symptoms are so vague. Symptoms are similar to the symptoms of other diseases. There are 3 parts of my video. Part number 1 is sinus symptoms. Part number 2 is diagnosis and part number 3 is treatment. So we can start with sinus symptoms. I have noted 15 very important sinus symptoms for you that you need to remember all these sinus symptoms. Number 1, chronic fatigue and tiredness. Yes, you feel tired, you feel fatigue all the time, although you have been taking good sleep and eating good foods with rich in vitamins and minerals, but you feel fatigue. Number 2, anxiety, depression, panic attacks. Yes, many research have proved that people with panic attack, depression and anxiety were found with low levels of vitamin D. And when they were given vitamin D, all their signs symptoms have gone. Number 3, immunity. Vitamin D is a booster for the immunity. And once it is having low level, then you have repeated infections, most likely respiratory infections. Number 4, muscle cramps. Number 5, bone pain. Yes, when the patients come into the clinic, they complain of multiple joint pains and think this is arthritis. Actually, it is not arthritis. It is due to the deficiency of vitamin D, because vitamin D regulates calcium and phosphate in our body. When vitamin D level is low, calcium level is low, which is needed for our bone, which is needed for our muscles. If vitamin D is deficient in children, there's a disease called rickets, when bones become soft. When the same thing happens in adult, it is called osteomalacia, where bones become soft and easy to fracture. If it happens after 50 years of age, it is called osteoporosis. You all must have heard osteoporosis. In osteoporosis, bones become brittle, easy to fracture. That's how the fracture happens in advanced age, because vitamin D is less and calcium absorption is less. Most likely the fractures we come across is hip fracture, ankle fracture, and fractures in hand, like that is called Colles fracture. Number 6 is skin. Skin becomes dry and with rashes. Number 7, healing. There's a decreased healing. The wound that should be healed soon takes longer time to heal up. Number 8, loss of appetite. Number 9, sweating. Yeah, sweating, most likely the sweating happens in hands, and most of the females come to the clinic mentioning that they have sweating in their hands. Number 10 is headache. Yeah, when they complain about the headache and their blood pressure is taken, the blood pressure is normal. So they have taken a good sleep. What is the reason of headache? When their vitamin D level was done, they were deficient in vitamin D. Number 11, loss of sleep or disturbed sleep. Number 12 is hair fall. Yeah, people spend thousands and thousands of dollars and rupees for prevention of hair fall or for the treatment of hair fall. but they don't go to the doctor to be assessed for their vitamin D level. Because if the vitamin D level is not corrected, no matter how much you spend, what treatment you get for the hair fall, it is not going to be corrected. So vitamin D is so important. Number 13 is blood pressure, increased blood pressure. Yes, vitamin D is responsible for cardiac health. Number 14 is obesity, belly fat. So people who had obesity, they were found when they came into the clinic, and when their vitamin D level, it was done, their vitamin D level is less. Number 15, in type 2 diabetes, it is seen that vitamin D level is decreased. And most of the research studies have proved that type 2 diabetic patients, when they were given supplements of vitamin D, their hemoglobin A1C level was corrected, was brought into the normal range within 3 to 6 months. What does that mean? It means that vitamin D plays an important part in diabetes as well. Now we come to the diagnosis. How deficiency of vitamin D can be diagnosed? Very easy. One blood test. So the normal range of vitamin D is 40 to 60 nanogram per ml. But if you have the deficiency, the level goes down below 20 nanogram per ml. Let's talk about the treatment. Number 1 is sun exposure. How many times in a week? At least 3 to 4 times in a week. For how long? 20 to 30 minutes every time. And what is the best time? The best time is 10 a.m. to 4 p.m. But most people prefer, and most studies mention that morning time is the best. Number 2, foods. Yes, foods rich in vitamin D. What are those? Milk, eggs, fatty fish including tuna, sardine, mackerel, cod liver oil, and fortified oranges. Number 3, vitamin D supplements. Yes, what supplements you need to take? Vitamin D3, not vitamin D2. Remember that very important point. People make mistake getting vitamin D2. So vitamin D3, 1000 to 3000 international unit. And depending upon patient's condition and sign and symptoms, doctor can write for you up to 10,000 international unit per day. Hello friends, I hope you liked my video. I try to put very important points at one place to make it simple and for you to better understand it. If you like it, please share it with your family and friends. And also subscribe my channel. So if I upload next video, you will get the notification. Please don't hesitate to make any comments. I would just take leave now in the hope that you will take care of your health. See you in next video. Bye.